What's happened in the mental health services is that functionally what's happening for us is that in order for Kaiser to make money, they're understaffing their psychiatry service and providing substandard care in order to keep the bottom line where they want it to be. It's an expensive service if it's provided properly.
It's clear to us who have worked in psychiatry at Kaiser that unfortunately treatment decisions and protocols in psychiatry are not made by those of us who are experts in psychiatry and work in the field and work with patients on a daily basis. As we see it, it's pretty clear that these decisions are being made from an accounting standpoint, that Kaiser's approach to treatment in psychiatry is about making money for Kaiser and is aimed at basically denying patients the treatment they deserve.
In general, what we're dealing with as providers is that we work in an institution or for a company that is requiring us to provide the bare minimum type of service, and what happens because of that is that the patients suffer.
It is upsetting to us professionally and ethically and morally to see patients suffering longer because we simply don't have the amount of staff that we should and are ethically required, we feel, to have in order to provide the services that patients need and deserve.
A lot of these things that we hear about what's happening at Kaiser, we hear in different industries and places in the world right now. And I think as a society we struggle with cynicism and resignation. This is where I get emotional. And that's what the therapists at Kaiser and the folks that have come together to form this union that we call the National Union of Healthcare Workers, we have come together so that we can make some change in the world. Not just to get better pay and get better benefits. Well, of course those things are important to us. Our primary goal here is to facilitate some change that makes patient care better, which in turn is part of making the world better, which also shows the world, hopefully, that we all can be an agent for change. We don't have to feel resigned and cynical and hopeless. We're here, we're doing something.